Welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for the Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us. My name is Mishka Balsam and I will be your moderator for the next hour. While organizations and governments are responding to the ever-changing pandemic impact, businesses have questions, and we're very privileged on a monthly basis to actually have this webinar with Dr. Hirji to really get to the bottom of some of the questions that are going to assist our businesses and organizations to move forward. But one of the things we've noticed over the last couple of months have been too is that we always have to remember businesses are run by individuals. So a lot of the questions that we actually we're able to get to in these webinars have actually been related to questions probably more likely coming from parents, caregivers, or those still attending post-secondary. And we're glad to take all of your questions. Today's format, same as what we have done in the past, is Dr. Hirji will provide an update on just the current situation in Naga. And it's always been really wonderful because there's an aspect of it that also looks at how does Naga fit in the greater picture of Ontario, Canada, and what we're seeing in the international scene. And at the same time, right after that, we will actually get to your questions. And I wanted to thank you, our participants. Thank you for being with us, but also thank you for providing us with your questions already in advance. If you are interested in asking a question during the webinar, if we can wait until Dr. Hirji has provided and completed his update, at that time, we would love to take all of the questions that are there, as well as the ones that have been submitted to us. For those of you who would like to ask a live question at the time, there's the symbol of a hand at the bottom of your screen or this chat option, and we will look for them on our end and we'll get to your questions. If you wish to enable live transcript, please refer to the bottom of your screen as well, and that allows you to do so. And on that note, Dr. Hirji, it's my great pleasure to have the webinar move over to you.
Okay, thank you so much, Mishka. And just want to reiterate, thanks to everybody for sending questions in advance. And when you do send the questions in advance, I do try and incorporate some of them into what I present. So hopefully it gives a slightly better explanation with some visuals attached to it. So I will dive right in. And unfortunately, as I think everybody has probably noticed, cases are once again going up in the province. And so there's not some great news to present today. This is what the case curve looks like here for the province. And, there's very clearly this new upswing in cases happening here. I think we've all basically said that this is the start of a fourth wave, and it's to be determined how high and how severe that fourth wave will be. But I think that is very much, unfortunately, what we are seeing. Switching over here then to the Niagara case curve, which looks pretty similar. There's been a little bit of a downtick very recently, but I suspect that's just your usual little, variations in data because our population is smaller than the Ontario population, so it's going to be a little bit noisier. I think everyone's probably wanting to know how we ended up here, and I think this really goes down to social interaction in society. I think we've always talked about how when you have more interaction between people in society, there's going to be greater potential for infection to spread. And I just want to pull this up by the Ontario Science table here. This is called the Oxford Stringency Index. It's basically a measure of how intense various restrictions in society are to limit social interaction. So, this here was the second lockdown in Ontario. This was the third lockdown. So obviously things became more restricted. And you can see here, this is a graph of people's mobility, of them being out and about and doing things. And of course, when more restrictions came up, people were out and about less. And because they're out and about less, they're interacting less. And so cases came down. Same thing happened with the third lockdown. And of course, we've fortunately gone a period where we've got out of that lockdown and had cases quite low. And things have been reopening quite a bit. And you can see we actually reached a point that has been lower than really going back to at least, the late fall of last year, where things are much more open. And of course, then mobility is much greater. People are interacting much more. And that creates opportunity for infection to spread, especially if they're unvaccinated people interacting with each other. Just to show you, another way of looking at the data here, this is, people where they are in various locations. Of course, staying at home was a big part of what was advised during the pandemic to control COVID. And you can see People are staying home at an all-time low now, which I think is consistent with the nice summer weather. And then if you look at transit or retail and recreation, where people are at a very high level compared to where they have been in past months. And that's, I think, to be expected. And we've reopened society. We certainly expect people to be out and about, doing things, interacting with people, partaking in businesses, and driving our economy. Just to quickly look at the similar sort of data here in Niagara. So this is people staying home, and you can see the amount of people staying home is now basically at an all-time low during this pandemic. The last time it was this low is going all the way back to March of 2020. And likewise, if you're looking at something like shopping and recreation, you can see we are at an all-time high in the pandemic of that, higher than we were even going back to before the pandemic, probably because it's summer as opposed to winter, and more people are going to be out shopping and partaking in some, fun activities. And so I think that level of interaction has unfortunately created the opportunity for infection to spread, especially amongst the unvaccinated people. And I just want to show you how this is sort of played out, to zooming in on that Ontario case curve now, just over the last couple months. Sorry, this scale got cut off, but this should be June 20th here. We go through July and then through August until today here. And so this is what the case curve in Ontario has looked like. For a while it's going down, and then of course more recently it's gone up. And key date here is of course June 30th. June 30th was the date we went into step 2 of reopening. And typically it's about 3 weeks until you start to see what the impact of a change in restrictions by the province has been. That's really the pattern we've seen through the pandemic. And so if we kind of draw in the start of step 2 and where we would see the impact of it, you can see step 2, before step 2, we were on a downwards trend. And then once the impact of step 2 is felt, is flat to maybe just slightly increasing. And then of course, in mid-July, the province went into step 3 here. And you can see what the impact of that is, that you see an acceleration of cases going up. And so very much the reopening of step 2 and then to step 3 is unfortunately what has allowed infection to spread, especially amongst unvaccinated people, and why we're seeing cases go up. And if I was to say that there was an error made by the province here, I think absolutely we set a downward trend. We should have gone into step 2. It was rushing ahead with step 3 before we'd really seen the impact of step 2 and known how quickly we maybe wanted to take that next step there. Just quickly looking here at the similar kind of analysis of Niagara, we were on a downwards trajectory. We went into step 2. We came out of step 2 pretty much flat. And then, we of course went into step 3 before step 2 had really had time to fully take impact. And you can see basically once we've come out of step 3, it's unfortunately been that upwards trajectory since then. And I'm not sure if I showed this slide here by the Public Health Agency of Canada last time, but I think this basically shows that this was somewhat expected. They had done modeling at the end of July and said that if we maintain the same number of social interactions, we will start to see a small increase in cases. But if we increase the number of people we are interacting with, of course, that is going to create more opportunity for infection to spread, especially amongst unvaccinated people. And you could see that very large increase. And I think, unfortunately, we have found ourselves in Ontario getting onto this track for now. I think a question probably everybody is wondering about is really about the impact of vaccination and why vaccination hasn't quite prevented that. And so I'll just do a quick detour to quickly talk about that. I think the first part to acknowledge, though, is what is the makeup of these cases? And I think, a key part of what we're seeing with cases is our cases are now overwhelmingly the Delta variant. This orange line here is basically representing the Delta variant provincially now, and you can see the Delta variant cases are going up. This blue line is the non-Delta variant cases, and you can see it's pretty much at 0. So we are basically now dealing with a wave of really just Delta variant cases. We've basically managed to suppress the non-Delta variant cases, but as we know, the Delta variant is more difficult to control, and so that is increasing. And if we look here in Niagara, this is the breakdown of our cases over the last 14 days. You can see on screening, over 90% of cases are Delta variant. Another 3.5% are confirmed to be the Delta variant. So, 96, 97+% of our cases are basically Delta variant now. there's very few cases that aren't the Delta variant. So that is basically what we're dealing with. And then, as I mentioned, the Delta variant, as we've gone through this pandemic and more variants have emerged, we have found viruses that are increasingly difficult to control, ending with that Delta variant. This is the reproductive number shown here. So for this is assuming that in a population where you're not doing anything to control COVID-19, how many people would one person infected spread infection towards? And so when the original version of the virus came out in Wuhan, is about 2.5 people it would spread to. When it got to Europe, there's actually a new variant that emerged in India when it was spreading there, which actually was spreading more easily. And so you actually ended up with a reproductive number up to 3. And then later on, we had the Alpha variant, which is over 4. And now we have the Delta variant, which is even higher. And if you look at where we started off with, the Delta variant is probably 2.5 to 3 times more quickly spreading than the initial version of virus. And so it's become increasingly difficult to control. And then just in this table, showing again what this means in terms of herd immunity. We started off only needing maybe a little over 60% of the population vaccinated to get to herd immunity. If we're actually dealing with this old version of the virus, we are actually above this level for fully vaccinated people. So we could actually have had herd immunity. And what herd immunity would basically mean is that you've pushed that reproductive number to below 1. So any person infected with infection is going to spread to fewer than 1 person. And so the virus will basically just die out thanks to the immunity in the population. Of course, we aren't with that original version of the virus anymore. We had that European variant that came about, which increased the level to get to herd immunity to 70%. We had the Alpha variant where it went up even more, and eventually we got to the Delta variant where we need to have upwards of 97% of people to have immunity to get to that stage. And so, noting that we can't actually get to this, given that 11 to 15% of our population are under the age of 12, I think it was a foregone conclusion, unfortunately, that we were eventually going to see cases go up. The end of this pandemic wasn't going to be this scenario where we vaccinate, we get to herd immunity, we completely, move past COVID, and thanks to immunity in the population, the virus will just kind of die out on its own. We're at a stage where once we reopen, we're not going to have enough immunity to stop the virus from spreading. So cases, the end stage is the cases are going to go up and they are going to spread. What we are hoping, though, is that vaccination will be high enough that when it does spread, it doesn't cause lots and lots of hospitalizations. It's basically like a cold virus spreading through us. We get sick, we get better, our hospitals aren't overwhelmed, and we're able to basically move on. That's, I think, really the end game that we're striving for. And, so when we're thinking about, what could happen with vaccinations and, what's going to happen with cases, hospitalizations are going to go up with cases, probably because we know that when cases go up, a fraction of people are going to be hospitalized. And particularly since most of our cases are unvaccinated, they're not getting any benefit of the vaccine preventing those hospitalizations. And so, the virus is going to spread through unvaccinated people primarily. It's going to lead to them being hospitalized at the same rate they were pre-vaccine, because these are the people who aren't vaccinated. And on top of that, because we have the Delta variant, hospitalizations are going to be more likely amongst those people because the variant is going to cause more severe illness. On the plus side, a couple things working in our favor is that the oldest groups are actually the most vaccinated groups, and they're the ones who are at greatest risk of being hospitalized. So that helps, that we've at least shifted that who's getting infected to being the people who are less likely to be hospitalized, noting though that they are more likely than in the past to be hospitalized. And then, a certain percentage of our cases are going to be the vaccinated people. We unfortunately do get some of those breakthrough cases. And because they have some immunity, they basically aren't actually going to end up being hospitalized. It becomes quite rare that they be hospitalized. And so I think the big question is, we're going to see cases going inevitably, but how do these factors play out to whether we're going to see also an unsustainable surge of hospitalizations, or we're going to see a controlled surge of hospitalizations that will be able to endure, similar to what happens every flu season. And, thus far, I think what we're seeing in Ontario is that we are seeing hospitalizations start to trend a little bit upwards. Obviously, nowhere near where we were in past waves, but, what's the potential we could rise to that level? versus it sort of tapers off at a level that is more manageable. And just to quickly show you here in Niagara, we've once again, we actually got 0 hospitalizations, and we're starting to see that trend up just a little bit, in ditto with ICU admissions. And so I'm just going to turn internationally to take a quick look at a few other countries here. The UK, the US, and Israel. These were all countries that early on got high levels of vaccination and reopened earlier than us. So I think we can take some lessons of what happened with hospitalizations. You can see here in Ontario, we're doing a little bit better than these countries, but we're not too far ahead of Israel or the UK. We're quite a bit more ahead of the US. So the US has the lowest vaccine uptake. UK and Israel come next, and then we're a touch higher than them. And so what happens in the UK and Israel is probably a pretty good analog of what's going to happen to us maybe. And so let's start off here with the UK, and this is looking at just cases over time. You can see they, reopened in May and June, and that of course led to a spike in cases. They had this, sharper spike that just came down, and now it's, on an upwards trajectory. And this is likely due to the Euro soccer tournament, which temporarily spiked their cases abnormally high, but they're probably on an upwards trajectory looking more like this. And you can see that their cases are now probably 50 to 60% of what they were at the peak of their previous wave. If we look here at Israel, again, they reopened and their cases started to go up, and you can see they're probably at about 2/3 of where the cases were previously. This here, sorry, that was the US, sorry, the orange line. This is Israel here. In Israel, you can see their cases are pretty much meeting what their previous wave looked like. And then just for comparison, this is us here in Ontario, where we've better controlled COVID, and of course, never had quite the same extent of case surges as the other countries did. And we're only slowly starting to see our increase in cases right now. So what did these increases in cases mean for hospitalizations? So these are now hospitalizations I'm looking at. So this is the UK here. UK's cases, remember, were up to about 50 to 60% of this wave. You can see their hospitalizations are leveling off. I think this is, where that had that Euro soccer tournament spike. Then cases came down, so that might be why the rise in hospitalizations slowed down a bit. So we'll see what happens there. But fortunately, we're seeing hospitalizations aren't rising as quickly as it did in past waves. Taking a look at the US then, where the US doesn't have the same level of vaccine uptake, they're seeing a big spike in hospitalizations. And you can see that they're probably 2/3 of the way to 75% of the way to their previous peak in hospitalization. So lower vaccine uptake seems to correlate to them having, a more difficult time keeping those hospitalizations down. This then is Israel. Israel not doing nearly as bad as the US, a bit closer to the UK, but they're probably at halfway point to what that hospital peak looked like. You may remember, though, that they had the most cases of any country in terms of how quickly things have risen. And so that's maybe slightly encouraging that while their cases are almost meeting their previous peak, the hospitalizations are maybe only 2/3 of the way there. And then, this is Niagara, this is Ontario, where we haven't really started to see the very much of an increase in hospitalizations yet. It's only slowly going up. So I think the lesson we're seeing here is that when cases go up, we are going to see the hospitalizations go up. We'll probably do better than the US, but we may be in the situation of in Israel or the UK, where the hospitalizations could go at least to as high as the halfway to the previous wave. And of course, they haven't stopped going up, so it could keep going up. And so we could be looking, to get hospitalizations somewhere in there, which of course did trigger lockdowns previously. So I think is a potentially worrying situation here still. This was some modeling done by Dr. David Fissman in Toronto, where he has actually taken hospitalizations over the course really of the first wave, second wave, third wave, and built a predictive model for how to predict those hospitalizations. And there's basically these inputs that go into the model. How many cases goes in? Because of course, more cases, a fraction of them will be hospitalized. And you also take into account testing volume. If you're not testing enough, you maybe aren't picking up all your cases. So that, helps determine whether you've got the full number of cases and what percentage will be hospitalized. The age of people being who are cases is going to be key. Of course, younger people are less likely to be hospitalized, older people more likely to be hospitalized. Vaccination is key because if people are vaccinated, they're less likely to be hospitalized. And if there's variants, of course, the Delta variant or the Alpha variant more likely to cause hospitalizations than previous illnesses. And so I think as we see cases go up, of course, this is going to be a predictor of hospitalizations going up. We can't really change the age of people or the VOCs. What we can do is change vaccinations. And so controlling hospitalizations and preventing a kind of wave that overwhelms our hospitals is really going to ultimately depend on getting vaccinations up and possibly putting in some measures to slow the spread of infection and keep cases a bit lower. And that's, I think, what we are potentially looking at going forward. And I just want to quickly pull up some modeling done here by the city of Hamilton. And quick thing here is they're looking at 4 scenarios: 70% vaccine uptake in the 12+ age group, and they're going to reduce the restrictions in society. 80% vaccination by reducing restrictions in society. 70% vaccination, but maintaining those restrictions in society to slow the spread of infection. And then likewise, 80% vaccination and slowing the spread of infection with ongoing restrictions. And so looking at the impact of vaccination and ongoing restrictions in society. And this is what they ended up seeing was modeled for hospitalization. So this is the third wave, the blue area where hospitalizations. And with 70% vaccination and lifting all of our restrictions, you can see this would be the wave of hospitalizations where it exceeds what we had in the previous wave. The good news is that if you get to 80% vaccinations amongst eligible people, so that's people 12 and up, you actually control that spike quite a bit. And then if you maintain some restrictions in society, you can actually push those even lower down. And just to show you that this then, that's actually, sorry, this was with cases, apologies. This is then with hospitalizations. And so you'd be seeing, the base case hospitalizations similar to the previous wave, but with higher vaccinations or a combination of vaccinations and restrictions in society, you can actually push that much lower. And I think the conclusion from that is that we do need to probably see higher vaccinations. And I think when you see policies on healthcare workers and others being required to be vaccinated, that's part of the province's push to try and get more people vaccinated. But I think we may also be seeing some additional restrictions on social interaction, perhaps just on the unvaccinated people, because that's where the virus is spreading, to try and bring us closer to something like one of these lines where we don't see that surge of hospitalizations similar to our past wave. Of note, this surge would happen without a lockdown. So this, hospitalization surge was limited by a lockdown. Here, it's not being limited by a lockdown at all. And so I think this advises us that we don't need an all-out lockdown. We're probably going to need more targeted restrictions and perhaps ideally targeted restrictions on unvaccinated people. And just quickly showing you here, this is a similar curve with deaths, showing in the base case we could have quite a lot of deaths, but with ongoing restrictions or some higher vaccinations, we can start to limit that. And so how high do we need to get vaccinations? Here they're talking about 80% in the eligible population, so that's 12 and up. I've previously shown this graph that, if we were at 75% of those 12 and up, the federal government's modeling shows that we would get very close, and in these gray lines, some scenarios would exceed our hospital capacity. But if we can get that up to 83%, we get to a stage where hospitalizations go up because cases will go up, but we fully reopen and we don't come near our hospital capacity. And so we're actually able to absorb that increase in cases. And that magic number seems to be 83% of people fully vaccinated, which works out to about 75% of the total population. Just looking at where we are right now in Niagara with vaccinations. So this is the eligible 12 and up population where we would need to get to 83%. We're of course still a little bit short, or the total population getting to 75%. And of course, the major room for growth of vaccinations is in the youngest age groups, and then even in sort of your younger and middle-aged adults, where the elderly, of course, are very highly vaccinated already. So I think that is what we're looking at going forward. Some of the questions submitted in advance were around third doses. So I want to talk a little bit about third doses. The US, of course, announced that they're going to go ahead and do third dose booster shots. And this is an article in the Washington Post this weekend where you can see there's some criticism that maybe the US has got ahead of the science. And I am very much of that opinion that the US is a bit premature, and this is probably not a good strategic choice for them to actually have made. If we take a look at how well the vaccine is working, these are some numbers actually put out by the US CDC. And so you can see that if you are vaccinated, there's an 8-fold reduction in your likelihood of getting COVID-19. But more importantly, a 25-fold reduction in being hospitalized or dying from COVID-19. And so the vaccine is overwhelmingly, working. It is definitely protecting people, and particularly protecting them from hospitalizations and deaths. And as I talked about, it's all about making sure we don't overwhelm our hospitals. So if we get everybody vaccinated, or at least 75% of our population vaccinated, we get to the stage where there's not enough unvaccinated people that there'll be enough hospitalizations to overwhelm the system. So I think the key takeaway here is the vaccine is still working really well. Even if you are seeing some of those breakthrough cases that unfortunately some people do still get sick with COVID-19, they're very rarely actually being hospitalized or passing away from infection. And so the vaccine is working. And then this is, additional data put out by the CDC, really looking at different countries and how well the vaccine's working. And so you can see in the UK here, 80% protection from infection, 88% in symptomatic infection, 96% hospitalizations. They looked at Canada, and we are 87% protection from symptomatic illness, basically 100% protection from being hospitalized or passing away. Israel is where they saw a little bit lower impact of the vaccine, where it seems like people are more likely getting illness from COVID-19 still, despite being fully vaccinated. But when you look at hospitalizations, you're not seeing hospitalizations or death very much. There's still excellent protection there. And when the US was looking at this is really what was driving them to want to move forward with for third doses, seeing the drop off in Israel and worrying that that was going to happen in the US as well. But I'd say that, you look at the UK and Canada, we're not seeing that impact. So I don't see as much of a case to go to booster doses here in Canada. I think the other key thing is in the US, they're talking about booster doses 8 months after the second dose. And we're actually only about a couple months out from most people become eligible for second doses in Canada, which might be partly why maybe we haven't seen that same waning. But that probably means we're probably 6 months out from being in the state the US is in, where they're going to start contemplating booster doses. So I don't think it's something that we're going to see in the near future. But I think, it's a bit of a strategic error to focus on booster doses and third doses right now. So if we take a look at our cases in Niagara right now, you can see overwhelmingly our cases are in the unvaccinated population. It's about 27% of our population is making up 72% of our cases right now. That's actually been as high as 80 and 85% in past weeks. The 65 or so percent of people fully vaccinated are only 19% of cases. So disproportionately low, whereas it's disproportionately high in the unvaccinated people. If you actually look at the comparative risk here, if you say a fully vaccinated people, they're going to be a risk level of, let's say, 1 to be getting COVID-19. A partly vaccinated person is about 7.5 times higher, and a fully vaccinated unvaccinated person is 15 times higher. And so if you're going to do booster shots, you're basically trying to vaccinate this group some more to hopefully maybe shrink this part of the pie. But this is the part of the pie that's driving your cases. Your cases are all in the unvaccinated population. And if you redirect pharmacies, primary care, public health to now go vaccinating this group, you're not actually stopping the cases where it's actually causing us all the trouble. And I think we want to keep our focus on vaccinating this group, because this is what's driving our pandemic. This is what's going to drive our hospitalizations up. And if we look here at our hospitalizations, it's even starker, where our hospitalizations are pretty much all in the unvaccinated. There's nobody currently amongst our active cases hospitalized in our vaccinated population. So you're going to be, wasting your time trying to redirect your efforts to the people not contributing to hospitalizations, and turning your attention away from trying to find these people and convince them to be vaccinated. I think the other big reason it's an error to focus on booster doses is we've had these variants emerge, which have been increasingly harder for us to control. And these variants have emerged in other countries where they have not been able to vaccinate their populations, so the virus has spread uncontrollably. And if we want variants to stop emerging and to make it more and more difficult for us, we really need vaccines to get to the rest of the world so they can vaccinate their population they can slow the spread of COVID-19 so variants stop emerging in those countries and coming and threatening us. And so I very much believe, I think third doses right now is an error for us. It's an error because we're not seeing waning immunity yet in Canada. We are going to distract ourselves from vaccinating the unvaccinated to instead vaccinate the fully vaccinated who are of minimal risk of stressing our hospital sector. And we need to make sure we vaccinate the rest of the world to get out of this vicious cycle where there's cases which spread to more cases, which cause variants elsewhere in the world, which cause more cases. We need to break that cycle, and that only breaks if we start to vaccinate the rest of the world. And that's where we need to be focusing our efforts. And any vaccine we are buying off to use here is vaccine that the developed world and the rest of the world doesn't have to vaccinate their populations. And I think that's another reason why we really shouldn't be going down that road. Those countries haven't been able to vaccinate because we have been buying off all the vaccine, and we need to now make sure they get the vaccine so we can break this vicious cycle. Last thing I want to quickly touch on is that there's some questions around workplace outbreaks. And so I'm just going to put up this chart here that shows really since the start of July to now what our cases have looked like in terms of outbreak settings. Overwhelmingly, I'd say these cases are largely in August because our cases were pretty low, fortunately, through most of July. Key thing you can see here is that most of our cases actually aren't part of any outbreak right now, or at least not an identified outbreak. It is people out and about interacting with each other. A lot of our cases are linked to family gatherings, social gatherings in private settings, and that's really what's driving a lot of our cases. Another big thing is we're seeing actually is international travel is contributing to a fair number of cases, with a lot of people traveling in the summer to other countries and unfortunately coming back with COVID-19 with them. And so I would definitely discourage travel at this time for that reason. In terms of then the workplaces we're looking at, the couple ones that stand out a little bit here is the food service and hospitality sector, where we've had a few outbreaks that have been a little larger. Fortunately, most of the cases have not been spreading between staff and clients. It's really been spreading mostly among the staff, with only a little bit of spread to patrons and clients. I think that's perhaps a recognition that it's been a fairly active sector, and there's maybe a lot of people traveling from elsewhere coming to here, especially other parts of the GTA, maybe coming down to enjoy hospitality sector and maybe putting a bit of greater risk there. But of course, there's also a fair bit of face-to-face interaction in a food service setting or perhaps in a hospitality environment, and that might be creating some of the risk. And so, I'd say for all workplaces, make sure you keep practicing those preventive measures, and especially in the food service and hospitality sector, make sure you do that. You can see a smattering in some other sorts of workplaces, none that are particularly jumping up. And then social settings here are, similar to what I was talking about here, where people are going out to a venue, having a social event, and that's leading to infections. And, I put up a slide similar to this last month around keeping workplaces safe, and I'm not going to go into detail on that because I talked about it last week, but just the key things about making sure you keep a workspace safe is keep screening people every day. If you identify people with symptoms, don't let them in the workplace. That's one of your best protections to actually keep the infection out of the workplace. Often in the workplace, people are really good about practicing preventive measures while on the job, but when they go into a break or a break room, they take off their mask because they're having coffee or a snack, and that ends up being the opportunity for infection to spread. And so make sure to have good measures in place for people when they're in breaks and break rooms. I've shown vaccination is going to be the key to getting us out of this pandemic. And so anything you can do in your workplace to facilitate vaccination is great. Strongly encourage your employees to get vaccinated. Perhaps give them paid time and transportation to go get vaccinated so you can make sure you have vaccinated staff in your workplace. If you want to go down the road of even having policies to nudge or disclose or maybe even require vaccination, those are certainly options as well. COVID-19 is going to spread through our population, and particularly through the unvaccinated population. And if there are unvaccinated people in the workplace, there's a very high likelihood that they are going to get COVID-19 in the coming months. And that's going to cause destruction in your workplace. So facilitating vaccination and getting the vaccine uptake as high and possible in your workplace, I'd strongly recommend. I talked about last month around improving ventilation and filtration to limit the ability of virus to spread through the air to others, making sure people continue wearing masks, and of course, wearing masks properly with making sure there's a proper seal and there's not gaps or it's sitting under the nose, making sure to wear eye protection if you're interacting closely with clients. That's really important to give those workers the additional level of protection. Make sure to have some sick policies in your workplace and support workers so that if they are sick and they come into the work, you are able to get them to honestly disclose symptoms and keep them out of the workplace so you're not spreading infection. So support them to actually stay home if they are sick. And of course, have their provincially required workplace safety plan. Continue to have hand sanitizer around so people can practice hand hygiene. It's probably not the biggest thing that's going to slow the spread of infection, but fortunately it's a cheap and easy thing. And so one thing that we would certainly continue recommending we do. And with that, I'll stop there and hand it over for questions.
Dr. Hirji, thank you so very much for your perspective and the numbers that you give me. They're always extremely welcomed, and I can see it in the comments that are coming back from our chat. So thank you very much for that. We are very much committed to getting to all the questions, the ones in the chat and any ones that you want to ask live, as well as those ones that have been submitted to us. So let me start out with one. I think it's a good follow-up to the information that you have shared with us. On August the 17th, the Ontario government mandated vaccination and testing in high-risk settings, including hospitals and some educational centers and so on. And we see over the last couple of weeks how post-secondary is also moving forward, especially here in Naga was having made some of those decisions. And there are, and I think it was last week, at the end of last week too, is that the 5 big banks in Canada announced, made a similar announcement too. So we see more and more the private sector coming forward too, and we are seeing the same initiative on the public sector. So we've been asked by a number of businesses to saying, are you foreseeing that other groups or industries actually should mandate vaccination before? Does it make sense for them, or are we expecting anything else so that businesses can prepare themselves for that?
Yeah, I'll maybe start with the second part of that, of what might be coming down from the province. I don't know. I don't have a prediction. I think there's going to be additional groups that are provincially regulated or, very heavily funded by the province that probably will get mandates to be vaccinated coming down the pipeline. Whether it becomes a broader thing applying to much more of the public or the private sector, I don't know if it's going to go that far. What I would say is that, the virus is going to spread through unvaccinated people until there's basically enough immunity there that it can spread, or we basically cut off social interaction so it can't spread to people. I don't think there's appetite to have any sort of lockdown or any kind of measures like that, and I don't think it's going to be necessary. Maybe there could be a restriction that you can't partake in some of these businesses if you're unvaccinated as a patron or client. That might be the kind of restriction that happens. So that might be a way you stop the virus from spreading through others. But otherwise, it's going to spread through everybody until we get to that herd immunity level of 97, 98% of people have immunity. We're at about 65% have immunity right now through vaccination. So getting from that 65 to 97 or 98% is going to be either through people getting vaccinated or through people getting sick with COVID-19. And for a workplace, if you have unvaccinated workers, that pretty much guarantees that in the coming months, your unvaccinated workers are going to get sick with COVID-19. So I think it makes a lot of sense as a workplace policy to have something encouraging vaccination. It could be, you're just going to strongly promote it. You're going to provide incentives. You're going to give time off work to get vaccinated, maybe have a disclosure requirement so people feel embarrassed if they've just been complacent and not got around to it, so they'll get vaccinated. Those could all be effective measures. Of course, the final one is, of course, you require vaccination in some fashion, and that's a choice as well. And, I don't want to tell businesses which of those to choose. I think that gets into issues of labor law, labor relations, the organization's values, all of those things. But I do think that there is a risk that you're going to see disruption in your workplace because employees are going to get sick. Unfortunately, some might be hospitalized and be off for a significant period of time. And you want to do what you can to encourage as many of your employees to be vaccinated so you minimize that disruption.
Yeah, thank you very much. And you're right, some of the questions are labor law questions, and may I redirect those participants who are interested in some answers to that. We held a webinar on this particular topic in the last couple of days, and those are available, and the link to it is available on our website as well. So if you are interested in it, it did address some of the ones of saying, what can you as an employer do, or as an employee? What are your rights and what are your options that you have there? One of our participants participants today is Kelly, and Kelly's asking, in addition to business mandating vaccines for staff internally, will there be an option for these public-facing business to require any volunteers or guests to be fully vaccinated as well? And I think it's a good question, because we've had a high number of individuals and companies reaching out to us and saying, how are we dealing with volunteers that are there? And volunteers are a critical part to many organizations, to the success of organizations. What do you anticipate on that note? And especially when we look at the health system, the hospitals, the long-term care homes, and a lot of them have and work with volunteers to make them as successful as they are.
Yeah. Again, there's a bit of a labor law issue here, so I can't fully answer it. I do think a lot of these settings, like long-term care homes and the like, have really actually effectively required vaccination of volunteers. And so I think they have been able to do that. We are seeing, different organizations are requiring people to be fully vaccinated. The MLSC, I think, has said that for their events, they're going to require people attending be vaccinated. We've seen other concerts and the like. I've heard of the odd, restaurant and the like, creating that requirement as well. So I do think there are definitely some businesses who see the value of it and are moving in that direction. I do think that if cases continue to rise and are getting out of control, the province may be forced to bring some restrictions, and it'll probably be restrictions on the unvaccinated, because that's who's creating the risk, and that way we minimize the economic harm from it. So I think there's a good possibility it might end up coming down from the province. One thing I think would be very useful is the province would create a vaccine credential, or the so-called vaccine passport, which would really ease the ability for a business to put that rule in place and administer it.
That sounds good. Dr. Hirji, I'm just making mention, thank you for being back actually on this one. No, makes full sense. The province also announced that although we're coming close to hitting the step 3 targets initially, they put a halt on further reopening indefinitely due to the Delta variant that you had spoken to as well. And there's a number of people on this call who are saying, how likely will it be that we're moving back to a step 2? And stage 3, when we talk about indefinitely, or the pause that is being put on there, when are we seeing ourselves possibly moving out of it? And just to get your perspective of it, taking the Naga and Ontario situation into consideration.
It's hard to read the tea leaves of what the government is going to do. I think it's pretty much going to be required. There'll need to be some restrictions on social interaction. And I think rather than moving to step 2, it could be that, we move people who are unvaccinated to only being allowed to partake in step 2 or step 1 activities, whereas the rest of us, if we're vaccinated, would be able to stay in step 3. So I think it's less likely we would see a wholesale move back to step 2, as opposed to we'd see restrictions that apply to unvaccinated people to limit them from partaking in these amenities, while the vaccinated people will continue, because I think there's less economic impact from doing that. And it creates an incentive for those people who've not gotten vaccinated to hopefully then get vaccinated. And it probably deals with actually the risk pretty narrowly and targeted in a way that's, going to be, work. So I see that as the more likely option of what happens.
Makes sense. I'm going to come to a couple of questions now that have come in via our chat. One of them is an update on people who have had dual vaccines. So 2 different types of vaccines. And if you can shed a little bit of light on that aspect of it. We have heard earlier on in the month that it restricts some travel restrictions, international travel restrictions are in place for those individuals. And some provinces and some of the states do have made different criteria and kind of looked at additional vaccinations for them as well. But can you give us a little bit of an update on that?
Yeah, so maybe starting just with the pure science, all the evidence continues to support that if you got mixed Pfizer Moderna, you have equal protection if you got 2 doses of Pfizer, 2 doses of Moderna. There's some suggestion that you might actually end up with slightly better immunity by actually having that mixed schedule. And we've actually seen with Pfizer and AstraZeneca, if you got that combination, you actually end up with better immunity than if you just had 2 Pfizers or 2 AstraZeneca. So I think in terms of your safety and your protection from the virus, it's going to actually turn out to be a really good option for people who got that combination. In terms of the administrative details of travel, I think that's where it's creating some headaches right now, because other countries haven't necessarily recognized it. I'm pretty optimistic that once we get to the point that the Canadian-US border reopens, that there's going to be an agreement between Canada and the US that the US will recognize everybody vaccinated with a Canadian vaccine schedule and vice versa. It's because the border hasn't reopened right now that it remains a bit of an issue where the US is only going to recognize their own vaccine schedule. Right now, I definitely discourage people from traveling just given the risk of COVID-19 with travel, so limiting traveling to essential reasons. And once we get to, I think, probably the spring and there's an internationally recognized vaccine passport, it's actually probably going to be something where even every WHO recognized vaccine series will be recognized by every country around the world.
Yeah, no, I appreciate it. This is a question from Christine, who's with us, and they're asking about a little bit of you could shed some light on the rapid testing that is available, because what they're looking at is saying that if you have a workforce and people have symptoms of COVID, naturally they would take them home. A lot of theirs have been actually vaccinated. But what role can rapid tests play for those ones who are currently not vaccinated, who might actually show some symptoms? What is the role when it comes to that?
So I'd say if someone is showing symptoms, they shouldn't be kept out of the workplace. You shouldn't go on to doing any testing for that. If you have symptoms, they need to get the full PCR test and be staying out of the workplace until we get that. If you have someone who's, comes, you screen them, they have no symptoms, the rapid test can be an, add-on there to make sure that someone isn't an asymptomatic case, a case who doesn't have any symptoms. It's about 50% accurate at picking up those. Obviously better than not doing anything. So you may pick up 50% of asymptomatic cases. So it does make the workplace a bit safer, but it is of course not perfect. Obviously the first line would be to get all those people vaccinated. If you don't have a requirement for them to be vaccinated, I think it is a useful way to add an additional layer of safety to keep people infected out of the workplace, but it's not going to be perfect.
Okay. That sounds good. We are finding ourselves in an election time at this point, and elections always come with candidate meetings, town hall gatherings, historically in other areas of it, for voters to get a better sense of the candidates, their platforms, and their policies as they're moving forward. When it comes to campaigning right now, what are some of the campaign guidelines for candidates? What are some of the things that voters should look at, and especially when it comes to volunteers? We have seen on social media from the candidates, they're practicing most of the safety bylaws that have been sent out, or guidelines that are there, which is really, really good to see. But when it comes to face-to-face town hall meetings, is this something that is recommended, or what are your thoughts on it?
Yeah, I would probably discourage those face-to-face meetings as much as possible. I kind of feel, we've gotten good enough technology over the past year and a half that we'd probably be able to run those electronically, and that would maximize everybody's safety. So it's my opinion that it's probably safest to do it that way. If there is going to be an in-person event, of course, screen people, maybe limit it to only fully vaccinated people to minimize the risk as much as possible. Space all the candidates out, space the audience out as well to minimize that risk there. And of course, have good ventilation in the building. So if any virus is getting into the air, you're actually clearing that out as well. For the door-to-door canvassing that may occur, I think that can be done relatively safely. So if someone's at the door, make sure they stay 2 meters away from you, but you can have the conversation. It's going to be outdoors on the doorstep, so it should be pretty safe, and I think that's fine. And the one other thing I'd advise around elections is that Canada's actually for probably 25 years allowed you to request a special ballot to vote by mail. I know back when I was in university, I was able to request those. I actually went online on the Elections Canada website, and it's actually very easy to submit your request for that now online. It only takes you 2 or 3 minutes. And I'd suggest that might be something a lot of people might want to consider, because now you don't need to go in person to that polling station. Who knows what cases will be like around September 20th. If you feel you can decide a few days before the election who you want to vote for, get that mail ballot, send it off in the mail. You don't have to show up to the polling station and take that risk.
Yeah, it makes actually sense. And actually, surveys have indicated that there is a highly expected rise of mail-in voting this year in the millions, something that we haven't seen. And we have normally only seen for people who are living outside of the country. So we are actually, that is anticipated and expected. And it's also interesting that likely, therefore, we don't get the election results that same evening too. So will be different, but I think it's something that people can take advantage of. There's one question from one participant. Let me get to it. The Delta variant and the risk when it comes to kids, those ones that are 12 and younger. And I was wondering if you can give us a little bit of a sense of that versus what we have maybe looked at previously with the different variants that we have looked at, where we thought that kids maybe were at lesser risk. Are they now at a higher risk? And I think this is a critical question, especially for those who are with us today, who are also parent of that younger age group that is there and are facing to going back to school in just a couple of weeks from now.
Yeah, so I think it remains true that kids are at lower risk of severe illness than older ages, but across all ages with the Delta variant, the risk has gone up. So while kids are still lower than others, it's higher than it was, with the variants we were dealing with 9 months ago. I talked about how the virus is going to spread through unvaccinated populations. And so I am quite concerned that we are going to see infection spreading within schools. I think we had reasonable success last year with, when we identified a case in a school, we isolated them, usually isolated the entire class, and we're actually able to prevent big outbreaks in schools as a result. I do think we're probably going to see a lot of that occurring this fall with a lot of, because cases are pretty high in the community, infections showing up in the school, classes being isolated, and there's going to be lots of outbreaks. Hopefully it will end up small, but I think it's not going to be a very smooth school year for that reason. And I'd really encourage, if you are one of the parents who has a child who's turning 12 sometimes this year, you're actually able to get your child vaccinated. So they're turning 12 sometime in 2021, or if they're older than 12, they can, of course, get vaccinated already. And you want to make sure they get vaccinated, because once kids are together in school and they're interacting, I think there is definitely the possibility we could see infection spreading amongst kids.
Yeah, no, that makes full sense. On that note, Dr. Hirji, earlier on in your presentation, you looked actually at workplaces and the areas where people are actually getting infected. And as more and more people are returning to work and are wanting to feel safe at work, and saying that most employers, I believe, are putting all the safety guidelines in place that are necessary for it. Can you quantify for us how many workplace outbreaks in Naga have actually taken place over the last months or two months? Because we have currently probably about 13,000 employers across Niagara that are there. Yeah. The percentage that you gave us, how many is it actually? Just to give people a sense, is it safe, and maybe safer than people anticipated to be?
Yes, sorry, I think there might be a slight delay in audio there.
I think there might be a slight delay in audio there.
Yeah, but it's good. We can hear you.
Okay, apologies. I'm also starting to get a bit of an echo. What I showed you earlier was the number.
What I showed you earlier was the number.
Sorry, are you getting the echo there as well?
And
are you getting the echo there as well?
I'm getting a delay in your messaging that is there. And try it again.
Okay. So what I showed earlier was the number of cases.
Yeah.
So what I showed earlier was the number of cases.
I think it was 7 or 8 outbreaks total.
It was probably,
majority of those outbreaks were actually this month, and the largest outbreaks were actually this month, which correlates with when cases are starting to go up. So it's not a huge number of workplaces yet, but I think you will see that perhaps multiply in the coming months if infections continue to spread at the level it's been lately.
Yeah, no, that makes sense actually, and it gives us a better sense of it as well. And On that, or in a similar note, actually, to the same that was there, is a question that is not directly related to COVID, but it actually is. And they were wondering if you could speak to the backlog of medical procedures that has happened because the hospitals have and the healthcare system has been so strained in dealing with COVID. Is there a way to maybe a way of us? We were looking at data differently than we have done them before. And we're now looking at first vaccine, people have been first vaccinated, second vaccination. We look at countries, we look at age groups, we look at the interactions that we have. But does it give us also a sense on the medical procedures that maybe have been delayed because of that?
Yeah, I think we have a good accounting of the medical procedures that have been delayed. I think the biggest challenge there is just the capacity in the healthcare sector. There's only so many surgeons and surgical wards and OR staff that you can have. There's maybe a little bit that we could do with additional provincial funding to maybe max those out. But unfortunately, I think it's probably going to be on the order of a couple of years to really deal with that backlog. Hopefully, the big thing we can do is manage this coming wave well, so we don't see that impact on hospitalizations, so we don't make the problem any worse. And of course, the biggest ticket to doing that is probably going to be making sure people get vaccinated.
And there's one last question I would like to get to that was provided to us, and it came actually in different ways from a couple of people. What is being done to advocate, inspire, and support a culture of wellness and health in Niagara? And it's really when we look at it and saying, are we going to go forward differently than what we have done in the past as we have done that? And I think it's a valid question, because I think we all are looking at our health and well-being differently. We look at the health of our colleagues and staff differently in a workplace, differently than we've ever done them beforehand. We often speak to it from a mental health perspective too, but what changes do you see, and are we advocating enough for that?
Yeah, no, it's a really good question. And one of my hopes is that after this pandemic, we'll hopefully recognize the impact that health has on the economy, and hopefully make some long-term changes for the positive. I think infection prevention measures, not to the same extent we have now, but maybe we can increase those a little bit. People maybe don't come to work if they have colds. We maybe continue to have hand sanitizer around. A few things like that might actually make a big difference in terms of workplace safety, and that could be really positive. But then thinking about things like mental health and chronic diseases, and actually quantifying how big an economic impact that has, and what would be the value of maybe investing a little bit more in prevention, and what would be actually the payoff of that. Hopefully we can change our mindset thanks to this pandemic to maybe think a bit more about investing early to prevent and seeing what are the big gains on the latter end from that. And that's something that I'm particularly hoping. And I think one other element we really realized is how social factors really impact health. It's something I've often spoken about, but I think it's something that hasn't really penetrated past the public health sector, that the socioeconomic conditions in which you live makes a real impact in how you experience health. And hopefully we've seen how that impacted COVID-19, where people are poor, people who are racial minorities, people who don't speak English have been more impacted by COVID-19. And we can now see that this actually applies to diabetes or heart disease or cancers. And if we can do more to help raise those people up in our society, it'll actually spill over to helping the health of them as well.
I think you made an excellent point on this one. And I think it's a perfect way actually to close up this webinar for today too. So my thanks go to all and who participate today, who were able to join us over this lunch hour in this valued conversation with Dr. Hirji. Dr. Hirji, thank you so very much for your valued time. And we're very much looking forward to connecting with you again next month, actually, for another webinar series, and hopefully with better number, more optimistic than maybe some of the data that we currently have seen, and maybe a slight improvement in the trends that we're all experiencing. For those of you who are interested in actually accessing the webinar or sharing the webinar afterwards, it is available on our website. It will be sent to you directly as well, and we're also sharing it through our social media channels. And on that note, I'm wishing everyone wonderful, healthy, and safe summer day. Bye-bye.